Dr. Claudia Espinosa is an assistant professor of pediatrics specializing in infectious diseases at the University of Louisville. Good to see you, Claudia. How are you?
Thank you.
Good to see you back. You've been on the program before. Well, let's talk a little bit. Let's start with hepatitis A because that's one of your specialties that you talk about. We've got this outbreak going on in Louisville. So why don't, as we sit here today, how many cases have we had in Kentucky, and what havoc is it causing?
Sure. So the health department has already said that about 350 something cases, approximately 352 by Monday, they increase probably every day, had been already detected. Many of them had required hospitalizations. About 240 something had been in the hospital.
So about two-thirds of them
Yes,
gone to the hospital.
which is high for the infection that it's auto-limited and benign most of the cases. And unfortunately, they have already issued that 3 people have died because of that. So this has been probably the biggest outbreak that we have had in years, especially for an infection that we can prevent with a vaccine. So that's the sad part of this.
Yeah, I want to talk about the vaccine here in a second, but what is hepatitis A, and how is that different from all the other hepatitises?
So it's a virus. It's one of the viruses that can cause hepatitis. It has this affinity for the liver and the hepatocytes. From all the classes of hepatitis that we know that exist, that one probably is one of the ones that is less causative of symptoms and chronic symptoms, I will say. But people who do not have antibodies, they are pretty susceptible. So they could have theoretically very ill, especially if they have any problems with the liver. So if the liver is damaged already, then they will have probably bad disease. But it is rare because most of the cases you see they get jaundice, they get low-grade fever, they get nausea, vomiting, and malaise, but they don't die. But those that have already comorbidities, especially the ones that had problems with the liver, they can get very complicated infections.
So folks who are alcoholics or have some
Exactly.
liver disease, they're more susceptible to getting hepatitis A.
And unfortunately, the outbreak here in Louisville in Kentucky, had been related with homeless and IV drug users.
IV drug users. So is that the main way that people are getting it?
No, actually, the main way how you get it is fecal oral transmission. So you don't wash your hands, especially after you go to the bathroom and you touch, food that is contaminated, and then that's the way how you get it. But this population had been specifically very susceptible during this outbreak.
All right, we're talking with Dr. Claudia Espinosa, who's an assistant professor of pediatrics specializing in infectious diseases at the University of Louisville. We're talking about the Hep A outbreak here in Louisville and in Kentucky. And of these cases, you mentioned that 2/3 were hospitalized. So how do you get from just having, you're feeling bad and, turning a little jaundiced to getting to the point where something happens that you have to be hospitalized? So what's that one thing that happens that pushes you over the edge to the hospital?
Well, the liver involvement. So, as I say, if you have your liver is not completely healthy and then you get this infection, then you get more symptoms than other people. They can be in the hospital because of cholestasis, because of the abdominal pain, because of the liver enzymes are really elevated, and that just cause other symptoms. So one thing after the other one, and then because of that they can have failure of the liver, and then finally that will cause the death. Fortunately, kids are less compromised, and in part because they had been vaccinated. But this is a disease that has affected primarily adult folks here in the area.
And we keep hearing about all these restaurant workers that have contracted hepatitis A. is that overkill to put that out in the media to say that some worker at Taco Bell or the White Castle has contracted hepatitis A? So if you ate at those restaurants between this time and this time, be on the lookout.
So I know that the health department had been all over, trying to figure out and making sure that all the regulations are in place for those things not cause any more problems. And I do know, I heard Dr. Lori Claudia, who is the health department metro medical director, and she has said that no cases had been linked to those people that had worked in these restaurants.
Right.
So I think that it is a little bit of alarm, but it's never a bad idea just to remember all those things. Get your vaccines if you haven't get it, and then just go and wash your hands all the time before especially eating anything. So, but no cases have been linked to those workers that had been sick.
Well, that's nice to know, because I did not know that we haven't had any other cases down the line where the workers were putting out the salad bar or something, and someone else might have contracted it. All right, that's good to know. All right, again, we're talking to Dr. Claudia Espinosa from the University of Louisville. She's in pediatrics, and we're talking about, she's also in infectious diseases at UofL. We're talking about the hepatitis A outbreak. All right, now let's talk about vaccinations. Right now, do all kids have to be vaccinated for hepatitis A before they get into school?
I am so glad that was now a mandatory request by the health department, because yes, we are doing vaccination and we do 2 vaccines. One when the kids are 18 months, and then the other one at 2 years or 12. Since 12 months, you can give the first dose, and then 6 months later. So that the new kids the little kids have been protected for a certain number of years. But unfortunately, the teenagers, they haven't, because we didn't have that recommendation before now. The health department issued a notice from, I got my letter because I have a child in the Jason Jefferson County school system, and I got the letter in December telling me that I needed to make sure that my kids were vaccinated, because by next year, so fall next year, every kid that is going into the system, they have to have the 2 doses of the vaccine. So the latest that they could be having the vaccine will be in February, I think mid-February, so they can get the second dose by the time they enter the school. And that is one of the major health care public measurements that we can get to have any outbreak, and to prevent future outbreaks. That's the good thing. We are not just doing this for this current outbreak. We are gonna prevent any in the future, because the vaccine is almost 100% effective, very safe, and the immunity lasts for a long time.
So parents, the word to parents, if you got a kid in Jefferson County schools,
Absolutely.
by August, you've got to have
two vaccines.
Two vaccines. And so they would have had to have a shot already in February, right?
Yes.
So what should parents do if they haven't had that, haven't had their kids with that shot? Go now?
Go now and get it, and just show the record that, in a couple of months you will have it, so the school can have, most of kids and actually adults, like 90% of them will have protection with just one shot. Okay. So it's a good thing that even if you have only one, you can have that protection. So just go and get it.
Okay. So and the recommendation for adults from the health department is the same. Adults should go have it. All right. I haven't had my Hep A shot, so why should I go get it? Convince me I should go get one. Well,
because you don't want to get sick. You don't want to get this infection ever, and it's a good thing. And as they say, very safe. You are not gonna have adverse events. A lot of people have gotten it when they go for evaluation before they go overseas, because we recommend it for most people when they are traveling to countries where there is endemic infection. But if you haven't got it, by all means, just go get it before you get any infection, because this outbreak is now, but we don't know when it is gonna come back, just because of those people that didn't get vaccinated.
Now, you did a study on hepatitis C in babies. Tell us first what hepatitis C is and how that's different from hepatitis A. Let's start there.
Sure. So hepatitis C is actually it's another virus that has affinity for the liver cells. And unlike hepatitis A, most cases will end up in chronic infection. A lot of kids, well, a lot of patients who have hepatitis C will end up with chronic infection, and the chronic infection will lead to cirrhosis and other complications of the liver. And finally, that's actually the main cause of liver cancer in adult population. So it's really sad that an infection causes cancer these days when we have so many resources, but that's the truth. We don't have vaccine for that one, like hepatitis A.
So there's no vaccine for hepatitis C?
There is no vaccine.
Okay. So what happens? You specifically looked at newborns.
Yes.
So what did you find?
So this is the interesting thing. Because we have had so many cases, an increasing number of people that are using drugs in the area of Kentucky and the southern Indiana too, then, there are, and the interesting thing is in the past, we used to think that was a disease that was only confined to certain population, like the baby bloomers and, associated with many things, but one of the things was in the past we didn't screen blood for hepatitis C many years ago. Well, that was the main reason for transmission in kids until up to 1994. But since that, when we started screening, the main route of transmission for babies and for kids had been maternal infection. So when we see now
so it got passed from the mom to the child.
Yes. So when we now see the epidemiology of these IV drug users, it turns out that they are not the old people that we were screening. These are young people, actually, white, non-Hispanic, and they live a lot of them live in rural communities. And so that's part of, some of research that I have done with looking at the Medicaid data with the unit. We have the Child Health Services Research Unit. And so now that you have all this population that is young, now a lot of women had been infected too, and it turns out that women, deliver babies, and that's exactly the ages where they had been infected when they can have babies. And so part of what motivated us to start doing all these studies was that there is not a lot out there to know what to do with those babies and to those women that are infected.
Are hospitals routinely testing babies for hepatitis C when they are born or shortly after they're born?
That is a really good question. So in reality, it's hard to test the babies. That's the thing, because the moms give the antibody to the babies. Okay. And the other test that we have, which is a specific RNA looking for the virus, it's not good in the first month of life. So really it's after the 2 months of life. So those are the babies. We are trying to capture those babies in our clinic so we can follow them. But they have a lot of issues, right? Many of them end up in foster care. Many of them, the records get lost, the names change, and so it's sometimes hard to bring them. And there is our rate for follow-up, for loss to follow-up or not showing our clinic from those exposed babies is about 50%.
Wow. Mm-hmm. And so many of these babies are being born to mothers that are drug users,
yes,
right? And are in foster care, wards of the state, whatever. So that makes it more difficult. And we may have buried the lead here with Dr. Claudia Espinosa because not the University of Louisville, but the Kentucky as a state is the first state to now screen, right?
Yes, so it is mandatory now for all women that are pregnant to get tested for hepatitis C, which has been a battle because in a lot of places there is this misconception that if you test, then what you're gonna tell the mother, you cannot treat it anyway. What is she's gonna have this?
You can't do anything about it if she's got hepatitis C.
Exactly. Well, right now, but they can get treated after delivering the baby. So that's the thing. We need to capture those so we can actually do something about it, because now treatment, so the difference between now and 10 years ago, it was 10 years ago the drugs were terrible. Interferon treatments were really, the treatment was worse than the disease. In some cases, the adverse events were really bad. And so now we have really good medications. And so we need to try to cure this disease. And the only way that we are going to eliminate hepatitis C is going to be treating those young population that are actually out there spreading the virus.
The young women, and then their babies once they get it. So you can treat the babies after they get to be a certain age, I assume, right?
Yes, and that's what we do. We just follow them because about 25 to 15 sometimes percent of the cases, the babies when they get the infection, they can clear the infection by themselves. We think that by the age of 2 or 3, we know which ones really are infected. And so that's what the testing that you were asking me about, the testing, when we test for the virus, looking for the virus at 2 months of age, but the final test is done at 18 months, and it is an antibody test, making sure that they got rid of the mother's antibody. And so that's the kind of problem in testing in the hospital. Now, what it is now important is that we are going to test the mothers. So at least because of the law, we are going to test those mothers, and the status of that mother is going to go in the record of the baby permanently. So maybe we can improve that follow-up rate. And we will be the first state on doing that because rates of follow-up for hepatitis C across the nation, they are really low.
All right, Dr. Claudia Espinosa, one more thing just before we wrap up here. Everybody go get your hepatitis A vaccine,
Absolutely.
right? And if you're a parent of a kid in JCPS, make sure your kid has the shots. Otherwise, they can't get into school in the
They
fall,
are going to
right?
ask you for that record, so go get it.
Okay, and you're going to continue doing work, I assume, on the hepatitis C
Absolutely.
research, right? Okay. All right, Dr. Claudia Espinosa, always good to see you. Thanks for being on the
Thank you,
program.
Mark.
All right, when we come back, what can you do in Belize if you're a student at the University of Louisville? Well, we'll find out in just a minute. You're listening to UofL Today with Mark Hebert on 93.9 The Ville.